everyone. My name is Laura Gottschalk. I am a national specialist with the American Lung Association's Health Promotion Team. So like I said, we're going to go ahead and get started with today's presentation titled Living with an Interstitial Lung Disease. And our webinar today was made possible with the support of Boehringer Ingelheim. So the American Lung Association's mission is to save lives by improving lung health and preventing lung disease. And our vision is a world free of lung disease. So our learning outcomes for the webinar attendees are to review what interstitial lung disease is and how it impacts the body, to gain a better understanding of what the progression of interstitial lung disease looks like, and to learn about treatment and management options, and lastly, to find resources and support for patients and caregivers. And just so folks know, we will not be having a Q&A today, but if you do have questions, please direct them to the Lung Helpline, which one of my colleagues will be sharing a link in the chat to the Lung Helpline. So just take a look out for that. And I want to introduce today's speakers. First, we'll hear from Dr. Erica Farrand from the University of California, San Francisco. Dr. Farrand is a pulmonologist and critical care physician who specializes in diagnosing and managing advanced lung diseases. Her primary interest is in caring for patients with interstitial lung disease throughout their journey. Dr. Farrand's research focuses on how to improve the delivery of high-quality, safe, and effective care in interstitial lung disease by working closely with patients, caregivers, clinicians, and health systems to reimagine how to deliver care to individuals with ILD. She is particularly interested in the use of digital health technology and health informatics to enhance how we collect and use meaningful information to diagnose, monitor, and manage advanced lung disease. Dr. Farrand earned her medical degree at Columbia University's Vagelos College of Physicians and Surgeons, where she also completed a residency in internal medicine. She completed a fellowship in pulmonary and critical care medicine at UCSF before joining the faculty. And she has co-directed the UCSF ILD program since 2019. So thank you, Dr. Farrand. We are very excited to have you on today. And we will also hear from our patient storyteller, Demi. Demi is a speaker for systemic sclerosis and the rare disease community. She is creator of BIPIC programs for Love of Children board member, as well as the driving force behind State Bill 133. Demi resides in Dayton, Ohio, where she is a wife, mother, and community volunteer. Demi is also the creator of Jacob's Hugs Registry and the Waiting Room Entertainment. She is a speaker, collaborator, and moderator for Patients Rising, Pulmonary Fibrosis Foundation Ambassador, Rare Disease Diversity Coalition Committee member, and a COPD Foundation captain with a featured film on the Disorder Channel titled Amy and Demi's Scleroderma Journey. Her responsibilities are to increase scleroderma awareness within her community and surrounding areas by obtaining proclamations annually, program writing, event coordinating, and volunteering for fundraising events. She attends Capitol Hill Days and meets with public officials regularly to advocate for research funding. She also creates interactive content for the disabled community at large. She is an alumnus of the University of Phoenix with an AA in Human Service Management and trained in mental health first aid. She is also the recipient of the National Scleroderma Foundation 2020 Advocate of the Year Award and 2022 Program of the Year Award for BIPIC. A big thank you, Demi, for being here today. And I'm going to turn it over to Dr. Farrand for her presentation. Thank you.
Good afternoon, everyone, and thank you for having me. And I really appreciate you all taking the time to join us for this session. And I really look forward to hearing from Demi about her experience and the wealth of information and perspective that she brings to this topic. We have a lot of material to cover, so I'm going to get started and we'll see how much of we can get through. Okay, great. Let's see, I'm having some advancement issues. Is everyone seeing, is that slide showing correctly for everyone? What is
Yeah.
interstitial? Okay,
Yep.
good. Just wanted to confirm. Okay, so I just want to start by saying that this is a hefty topic, an overwhelming topic, in part because interstitial lung diseases are rare conditions. And so unless you are someone with interstitial lung disease, or ILD as I will refer to it going forward, or are a caregiver or friend or loved one of someone with ILD, it is quite possible that you had not heard of the term beforehand, and so didn't come to it with a lot of background knowledge. And so there's a lot of information to wrap our heads around without really having a framework for how to approach it. Not to mention, not only is it unfamiliar, but as a community, we have not been particularly good at categorizing it and packaging it so it is easily digestible. There are a lot of acronyms. There's a lot of terms that are used interchangeably, some of which appropriately, some of which actually refer to very different things. And so just understanding the vocabulary of what we're talking about can be really challenging. And so this session is really to help to try to provide everyone with a strong foundation of what we mean when we say ILD, how this sort of presents, these diseases present, how we approach diagnosis, initial management, and what are some of the advanced management strategies we use, and how do we think about care from really the very beginning, early diagnosis, early disease, all the way through advanced disease. And so let's get started with just the term interstitial lung disease. And it really is an umbrella term that refers to a rare group of conditions that there are over 200 subtypes. But collectively, they're put together really because they collectively result in inflammation and or scarring in the lung tissue. And so when we think about lung conditions, we can think about conditions that affect the airways. Those are things like COPD and asthma. We think about diseases that affect the lining of the lung, the pleura. We think about diseases that affect outside of the lung, in sort of the space between the pleura. We think about diseases that affect the vasculature, and then we talk about diseases that affect the lung tissue or the interstitium. And interstitial lung diseases, while it can impact those other areas, is really primarily diseases that affect the lung tissue. And because they cause inflammation and scarring, they interfere with how oxygen moves across the lungs. So this is really zeroing in on where that oxygen exchange occurs. And so when we think about how our lungs are structured, we start with very big airways, your trachea, that carries the air in once you take in a big breath. And those airways branch and branch and branch until they get to these very end sacs. And that is where the air has to get to so it can cross across the lining of the sacs into the blood vessels. And we want oxygen to go from the lungs into the blood vessels, and we want carbon dioxide to come from the blood vessels into the lungs. And what we can see down here on the left is that interstitium is the space that the gas really needs to get across. And so if there is inflammation or scarring in that space, it makes it harder for the air to get where it needs to go. As I said, there are over 200 types of ILD, and some of those we have good ideas for their causes. Others, this is an area of active exploration, but things that we know either cause interstitial lung disease or are associated with interstitial lung disease are things like exposure to occupational or environmental toxins. So examples of occupational toxins would be things like silica dust and asbestosis, things in the environment, bird feathers, animal droppings, mold and mildew. And then we think about things like medications, particularly some of the chemotherapy agents and radiation. Smoking is a risk factor for developing interstitial lung disease and is the primary driver of some types of interstitial lung disease. We know that autoimmune conditions, things like scleroderma, rheumatoid arthritis, myositis, sarcoidosis, all of these conditions can also impact the lungs, and sometimes that is happening in addition to disease in the skin and joints and muscles, and sometimes the lungs are the first organ that's really impacted. We are increasingly aware that genetics plays a big component of this, and that many patients have an increased risk of developing inflammation or scarring in their lungs because of the genes that they have inherited. And then finally, we know that sort of navigating this world and having sort of comorbidities and infections, viral infections, uncontrolled reflux, that those are conditions that can also impact the lungs and have varying associations with interstitial lung disease and impact the course of interstitial lung disease. And then sometimes, despite sort of going through a very rigorous evaluation process, we're not really sure what the cause is of someone's ILD. And so it's really important for us to sort of vet what we think may be driving this, because it informs how we think about the diagnosis, the prognosis, and the treatment. Collectively, because interstitial lung disease are affecting the lung tissue, they have common symptoms. They can vary from one person to another, but some of the more common symptoms are shortness of breath, initially really with activity, but as that progresses, you can also feel short of breath at rest, a cough. In many cases, that's a dry cough, meaning you're really not bringing anything up, chest discomfort. Sometimes there can be bleeding into the lungs. And then often we will see some systemic symptoms, meaning loss of appetite, weight loss, fatigue, and particularly in patients who have an underlying autoimmune disease, muscle, joint, and skin symptoms. Because there are so many types of ILD, and because they have very different disease courses, it is really important to get an accurate diagnosis early on. And this is something that has really been the focus of the ILD community, is how do we support patients, their caregivers, and community providers in helping to get the resources to individuals that they need in order to get an early and accurate diagnosis. And so if you are someone who has been recently diagnosed with interstitial lung disease, we're going to talk a little bit about what are the next steps to make sure that how we have diagnosed your disease and how we're thinking about your disease reflects what is going on. The information that we use to make a diagnosis of interstitial lung disease is really sort of multiple components, but the big ones are chest imaging, generally a high resolution CT scan, lung function, those are your pulmonary function tests where you sort of sit in that box and we measure how air moves in and out and across your lungs. Blood tests, we're often looking for markers of autoimmune disease. Sometimes we are looking at genetic predisposition for developing interstitial lung disease. And then really getting a detailed history to understand what have you been exposed to in your life? When did the symptoms start? What has been the tempo? What has made things better or worse? All of those are clues for us to help determine what your diagnosis is. And then if ultimately, after collecting all of that information, we are still uncertain of the diagnosis, we will sometimes consider a lung biopsy as well. So these are all pieces of information that are used to make that diagnosis. And once you have a diagnosis, we really recommend trying to visit an expert care center for ILD. As we mentioned early on, these are rare diseases. And so often community providers, very well trained, will not have seen many cases of ILD over the course of their career. And so it's important to get connected with an expert care center, one, to just confirm that that diagnosis is correct, to think about your management options. And that goes beyond medications, but also how do we support overall quality of life with non-pharmacologic management. And we'll talk about that a little bit more, but that includes, just very broadly, oxygen, exercise, and emotional support and symptom support. And then what we really try to do with expert care centers is to partner closely with your local pulmonologist and care team to make sure that you have a multidisciplinary group that's supporting your diagnosis and management plan. One of the really important things to sort of get a handle on is, what do we think is going to happen? Once we have an idea of what is causing your interstitial lung disease or what category you fit into, many patients want to know, well, what can I expect over the next, several months to years? And the progression of ILD, again, varies significantly from one type to the next, which is why getting an early and accurate diagnosis becomes really important. Things that we look at for markers of disease progression are symptoms, patients feeling more short of breath, having increased cough, requiring oxygen when they previously didn't, or requiring oxygen in more settings. Changes in your lung function. So we use those pulmonary function tests over time to really see how the lung inflammation or scarring is responding to treatment and how it may be progressing, the rate of progression. And we look at chest imaging to give another marker of how things are moving along. Acute exacerbations are these defined episodes where the disease suddenly gets worse and it causes a significant decline in lung function and worsening respiratory symptoms. When we sort of suspect that an acute exacerbation has happened, often one of the first pieces of information we'll collect is a new CT scan, and we're looking to see if there's evidence of new lung damage on that CT scan. We also want to think about, are there reversible causes that could have triggered the acute exacerbation? In many cases, we cannot find one, but we're looking for things like infection or aspiration, things going down the wrong pipe and into the lungs, increased fluid in the body, things that we can target with antibiotics, getting fluid off, and supportive care. Not all causes of an acute exacerbation can be identified. In fact, in many cases, we cannot identify a cause, and then we're really looking to try to support someone through that acute episode. Not all patients are going to experience an acute exacerbation. We really first described this in patients that have idiopathic pulmonary fibrosis. But what we have seen as we have learned more about different ILD subtypes is that patients with other types of interstitial lung disease can experience an acute exacerbation, and having an acute exacerbation increases your likelihood of future exacerbations. And so it informs how we think about managing patients, because certain medications will reduce that risk. We also want to make sure that patients are aware that this is a risk, so that if they are experiencing symptoms that could signal an acute exacerbation, that they get to care quickly. So let's talk a little bit about management and treatment of interstitial lung disease. So again, we talked about that overall ILD causes a combination of inflammation and or scarring in the lungs. And inflammation in many cases can be reversed with certain medications. On the other hand, fibrosis is not reversible. And so the treatment options that target fibrosis are really to slow down the rate of new fibrosis or scarring. And in both situations, we think about medications that can treat symptoms and improve overall quality of life. So what are those medication categories? Just to go over them in big buckets. We have anti-inflammatory medications. So if we think that you have an interstitial lung disease that is primarily driving inflammation in the lungs, and we're seeing primarily inflammation on your CT scan, then we will use this category of medications, anti-inflammatory medications. And many of you are familiar with the medication prednisone. That falls in that category. When we're thinking long-term, we're thinking about medications that sort of are similar to prednisone, but can be used long-term. In patients that primarily have a scarring lung disease, or their biology has sort of evolved and they're really behaving like someone who has a primarily a scarring lung disease, then we're using medications that are targeting the scar. And again, those medications can't remove the scar or reverse the scar, but their goal is to slow down the formation of new scar. It's really important that we think about symptom management early on, and I'm going to come back to this point in a minute. But we recognize that even at the earliest stage of disease, many patients are experiencing symptoms. They're experiencing shortness of breath. They're experiencing a cough that really interferes with their quality of life. And so increasingly, ILD providers are trying to partner with their symptom management and palliative care doctors to think about how we can address those symptoms in addition to treating the primary interstitial lung disease. And then finally, the last category that we really think about for medications is comorbidities. Patients with interstitial lung disease have an increased risk of pulmonary hypertension. They often experience GERD or reflux, obstructive sleep apnea, hypertension, diabetes. And so making sure that we have control and are actively managing these comorbidities is going to impact your overall wellness and health. So very often, when we have those initial visits at an expert care center, we're focusing so much time on getting a good diagnosis and so much time on thinking about pharmacologic management that it is not infrequent that we don't ever get to the non-pharmacologic management in that first visit. And yet that component of the care is so important, equally as important as when we're thinking about what medications to use. And so let's talk about what those non-pharmacologic components of care are. The first one that I want you to really think about is oxygen therapy. So oxygen, not only does it have an impact on sort of managing your disease and treating your disease, but it also has an impact on quality of life. Very simple level, using supplemental oxygen can make it easier to breathe. It can make it easier to do the things that are important in your life. When we see patients whose oxygen levels are dropping either at rest or often it starts with when you're moving around, we really want to make sure that we are maintaining an oxygen level that is safe at all times. So all too often a patient will come into my office and say, Dr. Farrand, when I go out to the mailbox, I will feel short of breath. I'll come back home. I'll check my oxygen with one of those little pulse oximeters and it'll be 85. But I sit down and I take some deep breaths and, within a couple of minutes, it's back up to 90, 92. Is that okay? And the answer is no. Any time that your oxygen is dropping below 88, it is putting extra strain on your heart. And over time, that cumulative extra strain can cause the heart muscle to change. And that results in pulmonary hypertension. It also puts you at risk for things like cardiovascular events. And so our goal is to make sure that your oxygen is always in a safe range. And so there are two ways to do that. One is that you change the activities you do. And that is not our first choice. We want you to continue to walk and be active and do the things that you love. So the other option is really to give you supplemental oxygen so that you can use it to do all of the things that you want to do, but keep your oxygen at a safe level. We recognize that using oxygen has a big impact on quality of life. It is a big life adjustment. And so really learning about what are the options for delivering oxygen at home and when you're out and about can really help make the use of oxygen more digestible and make that transition easier. Pulmonary rehab. So the healthier and stronger you are overall, the more options we have to manage you in terms of pharmacologic options. It puts you, it makes it possible for us to explore lung transplant if that becomes something that you need. And then beyond that, it is sort of building your endurance. It's good for your emotional support because you are connecting with other patients who are facing chronic lung conditions. And there's often an education component component in pulmonary rehab. And as I started out saying, this is a lot of material to just digest. And so the more opportunities you have to learn about what it means to have interstitial lung disease and what can you do to keep yourself healthy and active, the better. And pulmonary rehab often provides another option for that education. Some of the advanced treatment options include lung transplant. So lung transplantation may be an option for patients with interstitial lung disease who either have very severe disease at the time of diagnosis or who, despite starting medication, are continuing to progress at a rate that makes us worried about respiratory failure and the need for really new lungs. Lung transplant can improve life expectancy when we are really thoughtful about when and who to pursue lung transplant with. But it really is replacing one chronic condition for another. And so the process of lung transplant is not for everyone. And it really takes close communication and coordination between your ILD physician, a lung transplant team, you and your caregivers to decide, one, does this medically make sense? And then two, does it personally make sense? And let's talk about that sort of decision-making process a little bit more. One of the jobs of your pulmonologist or ILD provider, particularly at an expert center, is to think about whether you could potentially benefit from lung transplant now or down the road. And if the decision is yes, there would be potential for a benefit, many centers will refer patients early so that you have plenty of time to learn about the lung transplant process and to undergo what is a very rigorous and long evaluation process. If the decision is made between you and your provider that lung transplant may be something that is beneficial to you, you'll be referred to a transplant center, and you start by learning about the process and whether that is something that you want to pursue. And then the lung transplant team will at the same time decide, are you someone who we should pursue evaluating for a lung transplant at this time, in the future, or whether medically this does not make sense or is not the right fit for you. If it's decided to pursue a lung transplant process, that is most often done in the outpatient setting. Sometimes when patients are quite advanced or progressing quite rapidly, it is done in an inpatient setting, but increasingly lung transplant centers are really trying to do that evaluation as an outpatient. And if you ultimately go through that process, the medical, emotional, and social evaluation, the lung transplant team and you decide, yes, this is the right time and the right fit, they will add you as on the wait list as a candidate. And then when donor lungs come in that are a match for you, both you and the donor lungs will be evaluated at that time. And if the decision is made that this is the right fit, they will move forward with the transplant. Post-surgery, as I said, you are treating one chronic illness for another. The lung transplant, post-transplant process and support is quite rigorous because we want to make sure that you do well with these new lungs. So it requires really closely monitoring you because you'll be on very special medications for the rest of your life. It means checking to make sure that you don't have complications, which we'll get into in a minute, and that your lung function is improving as expected. And so I think we've covered most of this. Again, there are general criteria for eligibility, and then each transplant center has specific criteria that they use. And so it's really important to understand what are the criteria at the center that you're going to be seen at, and do you meet those criteria? And that if there are questions, about that, those are things that you can talk about in advance with your local medical team. So the risks of transplant, again, this is a big surgery and there are many risks associated. The surgery itself, anytime you're going under a big surgery, going under general anesthesia, there are risks of from the surgery in and of itself. And then after a successful surgery, there's risks of your body rejecting the lungs. Again, they're foreign, so your body can reject the lungs. You can have side effects from the medications. You can have infection. And so this is part of why you really are committing to a long-term partnership with the transplant center as they get you not just through the surgery, but continue after the surgery to make sure that you are well cared for, you are progressing as expected, and that you have the support you need. So we've talked about oxygen, we've talked about pulmonary rehab, we've talked about lung transplant. Another benefit of an expert care center is clinical trials. And I think the ILD community has really recognized that one of the most important things that we can do is to make sure that clinical trials are an option for all ILD patients who are interested in participating. And that means that we really have to be thoughtful about the range of clinical trials that we're offering, the inclusion criteria, so making sure that there are trials that really allow for patients at all stages of diseases with all different interstitial lung diseases to be able to participate, and that we recognize that being in a clinical trial has it poses a burden to anyone who's participating, right? There's going to be additional visits, additional paperwork, additional risks of the interventions that are being studied. And so we really need to think about how we as a community can help to mitigate those barriers. But for you as a patient or a caregiver or a loved one, what I really want to encourage you to do is to go onto clinicaltrials.gov. That is a website that provides information on all clinical trials that are currently being run in the US. You can look for clinical trials in interstitial lung disease in your area to get an idea of what is available either now or coming down the pipeline. And I encourage you to talk to your medical team about opportunities to participate. Your medical team, your primary clinical team's job is really to help understand what are the priorities for managing your disease. What medications do we have available right now? How are you progressing? Are you stable? And then thinking about what is the correct timing for getting you engaged in a clinical trial if that feels like the right fit for you or is a priority for you. And then in just the last few minutes, I want to talk about the importance of palliative care and emotional and wellness support. So often when we think about palliative care, patients are immediately thinking about end-of-life care and trying to figure out when is it the right time to engage with palliative care. And as I mentioned, we have increasingly recognized that patients have significant symptoms even early in their disease. And so early engagement with palliative care and our symptom management colleagues is important to making sure that we are thinking holistically about the treatment of your disease, not just your ILD, but the impact it has on other aspects of your life. And so at my center at UCSF, we work really closely with our palliative care and symptom management colleagues and offer referral to that clinic even at the time of diagnosis for patients who are experiencing cough, shortness of breath, or even depression and anxiety and uncertainty about what the future will hold. It provides another source of support. And in addition to that, this care team often has other multidisciplinary team members that can round out how we think about your disease. That includes nurses who can provide additional education, nutritionists that can talk about, how do we improve your tolerability of medications that may have GI effects by making changes in your diet, and then additional sources of emotional and spiritual support, be it through chaplains or therapists and counselors. As patients advance in their disease, we think about hospice, and this really is thinking about end-of-life care. So once patients are really pretty advanced and we're shifting our focus towards symptom and pain management and away from trying to reverse disease, or slow down progression of disease. So it is not a withdrawal of care, but really a shift in the priorities or focus of the care. And hospice care can be done in a variety of settings, in your home, in a facility, or in the hospital. And the goal here is really to make sure that this component of anybody's care at the end of life is really reflective and respectful of an individual's values and priorities. And so we encourage early planning and discussion to make sure that this part of the care plan is as personal and representative of the patient as every other stage of the care plan. And then lastly, before I turn it over to Demi, for all of the caregivers and loved ones on the call, I just want to hold space that caregiving is a very challenging role to be in. And you're supporting both your loved one in this journey and also needing to support yourself. Caregiving can take a big toll. You're trying to learn a lot. You're often going to many visits, trying to participate in big care decision making, and it can take a physical, emotional, and mental toll. We know caregivers are increased risk for changes in their weight, both weight loss and weight gain, have higher rates of depression, anxiety, and fatigue. And so we encourage you to talk about what support options there are, either at an expert care center or locally for you. There are support groups for ILD and support for caregivers. And we recognize that it's important to have space for you in this conversation so that your needs are addressed as well. And so with that, I'm going to turn it over to Demi, who can really speak to her experience as a patient and an advocate.
Thank you. I want to thank the American Lung Association for having me. So I am Demi Montgomery, and I was diagnosed with scleroderma in 2001. I have had a severe case of it. I have diffused. So I have 6 amputations of my fingers and 1 toe. I also have lost the ability to extend my arms and legs. So I have a very bad case of scleroderma. My journey with ILD began in 2022. So I had one of those episodes the doctor was just talking about. I had gotten back from a trip, and because COVID had been so rapid, I thought I had COVID, and I was having problems breathing, and I could not really catch my breath. It was very scary. But I was thinking, okay, I have COVID. I can sweat this out at home. If it gets really bad, I'll go to the hospital. But that was not the case. So I ended up sleeping outside for a few days because I just could catch my breath better outdoors. So my husband was like, "No, we need to go to the hospital," and he took me to the hospital. And come to find out, I was having one of those exacerbations she was just talking about. So once that happened to me, it triggered me to have a heart attack. And so during that heart attack and all that process of all the testing they were doing, I did go through the pulmonary function test, the high resolution scans, all of those things. I did every one of them, and they came back and they said, well, you have pulmonary fibrosis, which is the scarring of the lungs. And it was really bad, and I was so confused. I had heard about interstitial lung disease because I have been a longtime advocate for scleroderma. So I had seen other patients handling it, and I knew that they were on oxygen and other things. So I was very, very scared. And I was like, okay, well, what do I do next? And so first I had to figure out what they were talking about. Because for me, sometimes when you speak with the doctors, they talk kind of over your head. And I was like, okay, well, I have to figure out what they're talking about. I'm going to have to start all over and learn this disease separate from the scleroderma, and which has been kind of a challenge. So first thing I did was start looking on Google, which is not recommended. So I started looking around, and that's when I found the American Lung Association, and I also found Pulmonary Fibrosis Foundation. Um, and both embraced me, and I was able to start attending their support groups and start to get involved with their advocacy. And from those parts, I was able to learn as I went. So by me being newly diagnosed, I knew that I still could qualify for some clinical trials. So I started looking those up, because most of the time, the earlier diagnosed, the better it is your option to get into a clinical trial. So I started looking for that. And that was positive because I was able to find that they had treatment centers available and other places that I could qualify to attend and be a part of. So as I was going through the journey, and I'm still going through the journey, I started learning ways and techniques to help with my breathing, because what happened is I can't really walk down the street without losing my breath or becoming short of breath. And it's very overwhelming at first. And I had to learn breathing techniques and ways to really cope with um, the lack of airwaves. And then I also have an inhaler that I use to help with that. But I do know that it's progressive, so I knew that it would be a journey and I was going to need help. So as I started talking more with the Pulmonary Fibrosis Foundation, they started teaching me the difference between idiopathic ILD and other different forms that they have. So now I'm starting to understand the language a little bit better, and I'm starting to understand the terms being used a little bit better. And what I have found out is that over the years of me having scleroderma for 23 years, that I was probably showing symptoms along the way that I didn't recognize. So for instance, a good example is sometimes my sides would hurt, and I didn't think anything of it, or I would go to walk around maybe the store or something like that, and I'd be very tired, and I just thought it was part of the scleroderma. But in reality, it may have been early symptoms and signs that I was going to suffer from ILD. And then I even remember at one time the doctor saying I had scarring, but not saying that I had anything major or seeming concerned. Now I know that those may have been signs, and that knowing the signs ahead of time could have helped me maybe to not get to the point where I'm at now. So I definitely can relate to seeing and recognizing early signs. So it's very important that you do recognize those, especially when they can actually help you, because they have treatments available and different things you can participate in now that really can um, slow down maybe the progression. So as time went on, um, I have actually started being more active on advocating for myself. So a lot of times in my community, which I live in an underserved community, in my community, the physicians don't really talk about clinical trials very much. So I have began to go in and start to talk to my physicians about clinical trials and maybe options that I have to participate in different things. And I think that it's better if you learn how to advocate for yourself, because when you are the one suffering, nobody understands your disease like you do. And it's important that you stand up for yourself and say, hey, I need help with this. I want to learn about this, and I want to learn how to save myself in a way. So I'm very big on the patient journey being a positive one and not a negative. So I feel like there's always a bright side to everything, and that we have the opportunity and the ability to create a good environment. And so I encourage a patient to become your own advocate, learn about your disease, learn about what steps you need to take to help yourself, find a community that's very supportive of you and that will encourage you, like I have with the Lung Association and the Pulmonary Fibrosis Foundation, that will encourage you to be positive and have a bright outlook on it and have activities and events and other things you can attend to be around others that suffer from the same disease. Because what I have learned is over the years that the communities actually help with uh, bringing everybody together, and you learn so much from each other, and just talking to each other can be very helpful. So I just want to tell you guys about my disease and my journey with scleroderma and with ILD, and I will turn it back over to Laura.
Thank you so much, Demi. That was great. We really appreciate you sharing your story. It's very meaningful. And a huge thank you to both of our presenters, Dr. Farrand and Demi. We really appreciate you being on today. That is always so great to hear from people. So just before we go, I do have a couple of things I want to touch on. First, please check the chat. A link to complete an evaluation for today's webinar will be popped in there. It's very brief and it'll only take a couple of minutes to complete, but we really value your feedback and we really try to take it into consideration when planning future events. And secondly, I want to take a moment to highlight the American Lung Association's resources. Our website, lung.org, has a well of resources geared towards helping patients and their families navigate living with a lung disease. For example, we have an entire webpage dedicated to hospice and palliative care and how to start the conversation with your care provider. You can see here a quick video that you can find on that page that goes into more detail about starting that conversation. Other resources you may find on our webpage are web pages that cover in greater detail how to live well with your specific lung disease and tips not only for patients, but for caregivers. I've included an example of what you might find on the PF webpage. This page that I've included right here, it highlights how to find social support and touches on joining online communities or joining a local Better Breathers Club. Lung.org also has numerous downloadable resources, such as various infographics, or there's even a medication tracker for med management that can be a helpful resource. There are so many things on our website, so I really encourage you to visit lung.org, poke around a bit, try to see what you can find, and I'm sure you'll find something that is very helpful and useful to you and your family, friends. And I will also be including a follow-up email with all the resources that I will speak of today, and I'll highlight some of the other ones that you would find helpful. So be on the lookout for that in the coming days. The recording of this webinar will also be included in that email, so you can watch or share. And those will also be included on our pulmonary fibrosis web pages and our interstitial lung disease web pages on lung.org. And so lastly, I do want to highlight a few American Lung Association programs. So first, I want to touch on the Patient and Caregiver Network. So this program provides individuals living with lung disease and their families access to research, support, and education. Signing up for the network is free. So if you aren't a member, please consider joining today. And please check the chat for a link to sign up and for more information. Next, I want to touch on the Lung Helpline and Tobacco Quit Line. So this is also a free service that can be accessed via phone or live chat. It's staffed by experienced licensed nurses, respiratory therapists, and certified tobacco treatment specialists who can answer your lung health questions or connect you to valuable resources. There are bilingual staff available, and there's live language interpretation services available in over 250 languages. So it's really a great resource. Then I want to touch on the Better Breathers Club. So this resource has connected people living with lung disease to education, support, and community for over 50 years around the country. So members can learn about ways to cope with lung conditions while also connecting with others in similar situations. Our website can help you find a local Better Breathers Club. There are also previously recorded meetings on there. So I encourage you to get on there, take a look. You might find something useful or interesting. And lastly, I want to touch on our online support communities. Like Demi was talking about, community support is so valuable. And so the Lung Association supports several free online communities through this resource, inspire.com. Some communities include living with a lung disease, living with pulmonary fibrosis. So these communities they help facilitate peer connection and allow members to share their stories about their own experiences. And it really does help facilitate that connection. And occasionally these communities feature events like the Ask the Expert. So this might be an event where a healthcare provider is available on the forum for about 3 days to answer and respond to questions. So again, I encourage you to go to inspire.com or go to lung.org and look for Inspire and join some of these communities because they really are a great resource. And again, I will reshare those resources as well as others in a follow-up email. And like I said, this webinar was recorded, so you will be able to rewatch and share in the coming days. And again, a huge thank you to Dr. Farrand and Demi. That concludes our webinar, and I hope everyone has a great afternoon. Thank you.